Chronic fatigue syndrome, CFS, also ME/CFS, is among the most enigmatic chronic illnesses. Sufferers experience debilitating exhaustion, neurological and immunological abnormalities, and often a worsening of symptoms after exertion, post-exertional malaise. Traditionally, researchers have long searched for viruses, inflammation, or hormonal dysfunctions as causes. But what if part of the problem is a learned response pattern of the body? A growing hypothesis suggests that CFS could also be understood as a classically conditioned immune and stress response, a kind of permanently activated alarm state that the brain has unconsciously learned. The good news, what is learned can, in principle, also be unlearned. In this comprehensive exploration, we want to explain this unusual perspective and show how targeted deconditioning, particularly through an attitude of serenity, can help break the vicious cycle. All statements are based on research and therapeutic experiences to offer patients, doctors, and therapists a new approach to thinking. Don't worry, this perspective doesn't mean that CFS is simply psychological or imagined. CFS is real, but the key to improvement might partially lie in the plasticity of brain and immune system. That's exactly where we begin. Conditioned immune response, a hypothesis for CFS. Many CFS patients report that their illness began after a trigger event, such as a severe viral infection or intense stress. The amygdala, an almond-shaped alarm center deep in the limbic system of the brain, might have learned something consequential during this phase. Ashok Gupta postulated as early as 2002 that during such initial trauma, a conditioned neural pattern can emerge in the amygdala. From then on, the unconscious amygdala reacts hypersensitively to signals from the body. Normal stimuli, such as light physical exertion, minimal inflammatory messengers, or certain environmental triggers, become conditioned stimuli that trigger an excessive stress and immune response. In other words, the body has learned to constantly sound the alarm even when no acute threat exists anymore. Vicious cycle. This model describes a cycle in which harmless body signals provoke a sympathetic response, stress reaction, which in turn generates inflammation and exhaustion. These symptoms are again interpreted by the hypervigilant amygdala as danger signals, a self-perpetuating loop. Patients feel as if their organism is stuck in an endless loop of fight-or-flight mode, immune activation, and deep exhaustion. This hypothesis, sometimes called the amygdala theory, sounds speculative at first, but it fits remarkably well with observations. Many CFS sufferers report that even small triggers, light, noise, stress, provoke severe exacerbations, as if their system were over-conditioned. And indeed, it's known from psychoneuroimmunology that the immune system is conditionable. Even the famous Pavlov showed in dogs how reflexes can be trained to new stimuli. A pioneer in this field was Robert Ader, who discovered in the 1970s that the immune system is conditionable. His work laid the foundation for understanding that psychological processes can influence the immune system. Modern studies found analogously that even immune reactions and hormonal responses can be coupled to certain stimuli. Immunologist Gustavo Pacheco Lopez, 2006, and colleagues demonstrated that, for example, the effect of medications on the immune system can be learned through a neutral stimulus, like a taste or smell, and later triggered again by this stimulus alone. A 2017 review confirmed numerous cases of classical conditioning in humans, including immune suppression, allergic reactions, and insulin responses. So it's biologically plausible that an excessive defense or inflammatory reaction in CFS is at least partially a learned pattern. Important, this perspective takes nothing away from the physical reality of suffering. Rather, it offers an additional explanation for why symptoms become chronic. If the illness is based on a kind of false alarm program of the brain, then we can, parallel to medical therapies, try to systematically interrupt this program. Learning and unlearning. How deconditioning works. How can one break a once-learned vicious cycle? Here comes the concept of deconditioning into play, the targeted unlearning of a conditioned reaction. Our brain is amazingly plastic. It constantly adapts based on experiences. What's learned can be overwritten or weakened through new learning experiences. First, a brief excursion into learning psychology. In classical conditioning, a neutral stimulus, e.g. a smell, is presented together with a meaningful stimulus, e.g. an immunoactive medication. After several rounds, the body reacts to the neutral stimulus alone, as if the medication were there, a conditioned response. Deconditioning, or extinction, means dissolving this connection again. This succeeds by repeatedly presenting the triggering stimulus without the expected bad consequence occurring. The brain registers, "Wait, my prediction was wrong," and gradually adjusts the response. The central keyword here is the prediction error. A positive prediction error occurs when something unexpectedly bad happens. This teaches fear. A negative prediction error occurs when something unexpectedly harmless happens. E.g., you expect pain or danger, but it doesn't occur. Exactly this moment of surprising absence is the key to unlearning. Negative prediction errors are the source of successful fear extinction, as it's called in learning research. The brain updates its models. The previously feared stimulus loses its terror. Applied to CFS, this means we must repeatedly prove to the brain that certain signals or activities are no longer threatening. Of course, this is easier said than done because often everyday activities actually feel dangerous since they can intensify symptoms. Here, careful dosing is key. More on this later in the practical guide. Important, every experience in which an expected crash doesn't occur or turns out weaker than feared is gold for the brain. Exactly such experiences should be consciously cultivated, in a safe framework, step by step. Neurobiologically speaking, deconditioning usually doesn't mean that the original fear memory is deleted, but that new pathways emerge. The brain learns a new reaction, e.g. calm instead of alarm, that overwrites or inhibits the old one. However, these new paths must be regularly strengthened, otherwise the brain falls back into old patterns. Consistency and patience are therefore crucial when unlearning a chronically conditioned pattern. Serenity instead of stress, the idea of functional indifference.
A central tool in deconditioning CFS seems to be a specific mental attitude, a state of calm serenity or functional indifference towards arising symptoms. What does this mean? Imagine the body sends the familiar signal of exhaustion or pain. Our usual reaction to this is understandably alarm, frustration, fear, or fighting. "Oh no, not again." However, this emotional cognitive reaction might, according to the hypothesis, be exactly what the amygdala sees as confirmation of its alarm. With every panic and every despair, the brain learns, yes, there's danger, keep firing alarms. Functional indifference, on the other hand, means we perceive the symptoms but react internally as neutrally as possible, neither anxiously avoiding, that would be resignation or submission to the illness, nor aggressively repressing, that would be denial, pushing away at any cost. Instead, we practice a kind of equanimous serenity. Ah, there's that feeling again. It may be there, but I don't give it special meaning. This attitude corresponds to what psychology also calls mindfulness with acceptance, perceiving without judging. One could say it's an active form of indifference. Active because it's a conscious mental process that's practiced, not mere passivity. An example of this is dealing with exercise. Instead of avoiding exercise entirely out of fear of symptom worsening, or forcing yourself to train as if no symptoms existed, functional indifference means exercising at a moderate pace and stopping as soon as fatigue increases. This way you avoid both resignation, no exercise at all, and aggressive denial, exercise to exhaustion. This attitude helps reduce the body's conditioned stress response by signaling to the brain that no real danger exists. The concept can be beautifully illustrated with a quote from Buddhist monk Thich Nhat Hanh. Equanimity means to let go, not to abandon. In other words, we let go of excessive identification and tension without giving up on ourselves or abandoning responsibility. Serenity thus clearly differs from fatalism. Resignation would be, I don't care, it'll never get better anyway, I give up. Serenity, however, I accept what is now, without falling into panic or bitterness, and remain open to change. This indifferent attitude signals to the brain's alarm center no real danger here, which can weaken the conditioned stress response over time. Interestingly, this mental attitude has been highly valued in great wisdom traditions for ages. In Buddhism, one speaks of upekkha, equanimity, as the fourth of the Brahmavihara, four immeasurables. It's defined as a deep strength and evenness of mind unshaken by emotional ups and downs. In Greek Stoicism, there's the similar idea of ataraxia, literally unshakability, a clear state of robust equanimity, characterized by lasting freedom from worry and turmoil. And also in Christianity mysticism, such as with Meister Eckhart, there's the concept of Gelassenheit, a trust that nothing can shake. All these concepts emphasize true serenity is not in defense from coldness, but benevolent neutrality. Marcus Aurelius aptly wrote, "If something external troubles you, the pain doesn't come from the thing itself, but from your judgment of it, and you can change this at any time." This philosophical insight fits remarkably well with our topic. The way we evaluate our symptoms significantly influences how intensely we suffer from them. By changing the evaluation away from catastrophizing towards serene observation, we can reduce suffering without denying reality. John Kabat-Zinn, founder of MBSR, summarizes it aptly. The moment you stop fighting, healing begins. These words underscore the transformative power of acceptance and serenity in the healing process. In summary, functional indifference means not adding additional fear or despair to the symptoms.
One cultivates an inner attitude of, it is as it is, and it may be there in the moment. This attitude must be practiced, initially perhaps in short moments, example through breathing exercises or mental sentences of permission. I allow this feeling to be there. It may come and go. Over time, the brain internalizes this calm as a new normal situation. This reduces false alarms, because like a smoke detector that realizes that smoke, the symptom, is not equivalent to fire, danger, the amygdala also sounds alarms less frequently and more quietly. Neurobiology, amygdala, prefrontal cortex, and prediction errors. Let's look more closely into the brain to see what happens during unlearning. We had already identified the amygdala as a central player. It's part of the limbic system and processes emotional stimuli, particularly fear and alarm. In CFS, it might remain in a constant alarm state and repeatedly trigger stress hormones and immune messengers. Another important brain region is the prefrontal cortex, PFC, especially the medial prefrontal cortex directly behind the forehead. This area is responsible for higher evaluations and control of emotional reactions. One could simplify it as the cautious reason director who can rein in the impulsive amygdala. Research on fear and trauma shows recovery often goes hand in hand with reactivation of the PFC, which sends inhibitory signals to the amygdala. Indeed, Gupta also suspected in his hypothesis that recovery in CFS occurs through strengthening connections from the medial PFC to the amygdala to break its overreactions. This is exactly what we achieve through mental-emotional practice. We train the prefrontal boss in the head to react sovereignly to alarm signals, with serenity instead of panic, and thus calm the amygdala. Another fascinating mechanism concerns the reward system and the neurotransmitter dopamine. Recent studies on fear extinction show that special dopamine neurons in a brain region, ventral striatum, signal an extinction prediction error. When the expected danger fails to materialize, they fire and mark, "It's safe, you can relax." This signal then supports the amygdala PFC circuits in unlearning. It's fascinating. The same neural principles that work in overcoming phobias or PTSD could also be effective in a chronic illness syndrome like CFS. Because CFS often also includes unconscious fear, not in the sense of psychological fear of something external, but the body's fear of internal sensation and exertion. Some scientists therefore speak of a kind of limbic system trauma in CFS, comparable to a trauma response except that the trigger is internal. In summary, neuroplasticity, the brain's ability to change its wiring according to use, is the key. With every practice of Serenity, we strengthen prefrontal control networks, calm the amygdala, and hopefully generate many small negative prediction errors. Experiences that show the body nothing bad happened. Piece by piece, the alarm network can thus decouple. These changes are measurable at the neurochemical level. For example, in patients with fibromyalgia, a CFS-like pain disorder, after 8 weeks of training in mindfulness-based amygdala retraining, a significant drop in BDNF levels in the blood was found, a growth factor associated with chronic pain stress. At the same time, functions and quality of life improved significantly compared to a control group. Such neurobiological markers support the view that mental unlearning leads to tangible physical changes. The brain rebuilds itself. Stress mediators decrease, the body finds balance more easily. Study evidence: how mind and immune system interact.
The idea of influencing CFS through mental techniques may seem novel, but there's already a series of studies supporting individual elements of this approach. Meditation and Immune System, Davidson et al. 2003. In a much-noted study, an 8-week mindfulness-based stress reduction (MBSR) training was examined. Result: meditators showed a significant increase in left-sided anterior brain activity, a pattern linked to positive mood, as well as stronger antibody responses to a flu vaccination compared to the control group. Meditation thus changed the brain and strengthened the immune system. This is impressive evidence that targeted mental training can influence physical healing processes. Pain and Serenity, Zedon et al. 2011. Just 4 days of 20 minutes mindfulness meditation led in a study of healthy individuals to a dramatic reduction in pain perception. Subjects found a standardized heat stimulus 57% less unpleasant than before training. Brain scans showed that meditation enabled non-judgmental processing of sensory stimuli. Activity in prefrontal and insular areas increased, while pain-associated areas like the somatosensory cortex and the suffering network were downregulated. Translated, this means, through Serenity training, even intense body signals can lose their sting. You still feel them, but suffer less from them. This fits exactly with the concept of making CFS symptoms more bearable through changed evaluation. Conditioned Immune System, Pacheco-Lopez et al. 2006. As mentioned above, this and subsequent work impressively showed that the immune and hormonal systems possess learning ability. Placebo effects, for example, are now partly understood as learned physiological reactions. For CFS, this means the immune system can be in a learned alarm mode, but it could also unlearn through new impulses. There are even animal studies where autoimmune diseases were positively influenced through reconditioning, e.g. lupus conditioned away in approaches. While research in humans is just beginning here, the principles are validated. Therapy programs and initial data. 2 approaches using the principles described here are the Gupta program and DNRS, Dynamic Neural Retraining System. Both are neural retraining programs that teach sufferers over weeks how to exit negative symptom thought loops, put their body into relaxation, and use positive visualizations. These programs are based on the assumption of an overexcited limbic system. While they emerged outside classical medicine, initial studies give hints of effectiveness. In a pilot RCT 2020 at the University of Navarra, Spain, Gupta amygdala training was compared with a relaxation control group in fibromyalgia. The results were promising. The Gupta group showed clear improvements in function and quality of life compared to controls.
84% of participants achieved clinically relevant functional improvement, then 30% reduction in fibromyalgia impact score, compared to only 19% in the control group. Pain catastrophizing, anxiety, and depression scores also dropped by some 40 to 45%, significantly more than in the control group. These effect sizes are remarkable. The authors write that the program had moderate to strong effects on diverse outcomes like functional impairment, disease severity, quality of life, as well as psychological processes, mindfulness, self-compassion. Although these are only preliminary data, they're encouraging that limbic retraining can cause real changes. Many individual reports from CFS patients, both with DNRS and Gupta, describe significant recoveries, sometimes even to careful full remission. Of course, more independent research is needed, but those who wait until everything is proven might waste precious time.
Additionally, it should be mentioned established approaches like MBSR, mindfulness-based stress reduction, or biofeedback, as well as body-oriented procedures such as Qigong, Tai Chi, or body therapies, ultimately also aim to readjust the nervous system and reduce the stress response. They can all be building blocks of a comprehensive unlearning process. Depending on individual access, one might start more with formal meditation, another more with active visualization routines, as with DNRS. What's important is the end goal, leading the brain out of alarm state back into balance. Practical Guide: 3 Steps for Daily Life.
How can one begin to implement this idea of deconditioning oneself? Here's a simple 3-step plan as a guide for daily life. Step 1. Recognize and understand, becoming an observer. First, it's about consciously perceiving your own symptom patterns and understanding the concept behind them. Make clear to yourself, your body might be reacting automatically like an incorrectly adjusted alarm. This alarm doesn't mean you're doing something wrong or that something is irreversibly broken. It's a learned pattern. This cognitive understanding alone can be relieving. My body is overprotecting me with good intention, but it's a maladaptation. Then notice in daily life when you go into alarm or despair. Maybe write down typical triggers and your reactions. The goal of step 1 is to move from being a victim of reactions to becoming a benevolent observer. Imagine part of you puts on researcher glasses. Aha, my heart is beating and fatigue is overwhelming me. Interestingly, right after I climbed the stairs and thought, I'll never manage this. This metacognitive perspective, observing yourself, already creates some distance from the symptom and weakens the fusion with the negative. Step 2. Practice new reactions, setting serenity anchors. This is the core, practicing to react differently than usual. For this, initially choose a milder symptom situation or smaller trigger for practice. For example, you feel light pain or exhaustion coming on. Exactly in this moment, you stop automatic brooding or anger and consciously switch to functional indifference mode. What can this look like concretely? A few approaches you can combine. Breath relaxation. Close your eyes if possible and take 3 to 5 deep breaths. Direct the exhalation into your belly and extend it. Slow exhalation signals safety to the brain. Imagine you're simply breathing out inner tension. Inner dialogue. Say calming sentences to yourself mentally like, "It's okay. My body is sounding alarm right now, but I'm safe. I stay calm and let it pass." Or, "I feel you, fatigue, pain. You may be there, but I'm not giving you energy." Find words that give you a feeling of control and calm. Some use humorous sentences like, "Hello, symptom, there you are. Make yourself comfortable in the corner. I'll meanwhile attend to something else." Important is the tone of inner interaction. Friendly neutral, neither fearful nor angry. Distraction or reorientation. Gently direct attention away from the body signal towards something pleasant or neutral. For example, listen to a favorite song, look at the sky, take a few steps in fresh air and feel the environment. It's not about repression, but refocusing, showing the brain there are more important things than the false alarm. Visualization. Some use images, such as, imagine your body is an overstimulated animal that you calm with stroking. Or visualize the amygdala in your brain, which was like a fire-breathing dragon, and now you paint yourself playing a lullaby to this dragon until it snuggles up. As childish as this sounds, our brain responds well to stories and images. All these techniques serve to make the moment of symptoms into a practice moment. Instead of the old path, symptom, fear, anger, amplification, you strike a new path, symptom, serenity, confidence, calming. The first time, this might only last seconds and feel strange. That's normal. But with each time you manage to stay even a little calmer than before, your brain celebrates a small success in the direction of reprogramming. It learns, hey, it worked without huge alarm too. Like muscle training, it gets easier with repetition. Step 3. Integrate and increase, solidifying new normalcy. Plan these exercises daily, preferably multiple times. Initially, you can schedule short formal practice times, e.g., 10 minutes of meditation or affirmations in the morning. But crucial is integration into daily life. Every situation can become a stage. In traffic jams, while brushing teeth, waiting for the doctor, use micro-moments to cultivate serenity. Celebrate every small success, even if it seems subjectively tiny. Today, I was somewhat less exhausted after the phone call than usual because I breathed calmly during it. Great! This positive self-reinforcement motivates the brain to keep learning. Over time, you can tackle bigger triggers. But it's important to increase carefully. Don't grossly exceed your stress limits. That leads to setbacks that rather confirm the alarm. It's not about forcibly exposing, like in classic behavioral therapy, but about making experiences in safe doses that the body can process well. Maybe start with 5 minutes walking in the room while staying completely equanimous, instead of directly pushing 15 minutes outside. Slow is fast in this process. Rather small steps, but consistently every day. Another part of Step 3 is including support, whether through therapeutic accompaniment, online groups, coaching programs like DNRS/Gupta, or with practice partners. Exchange can motivate as long as it stays positive. Share your progress, but avoid endless focus on symptoms in conversation. Use fellow travelers as a sounding board for progress, not for spiraling into negativity. Pitfalls and opportunities on the way. Every path of change has pitfalls. Here are some common stumbling blocks and how to master them. Am I to blame for my illness? No. This hypothesis doesn't mean you triggered CFS through wrong thinking. Conditioning happens unconsciously and usually through hefty external influences. It's nobody's fault. On the contrary, many have willfully fought against the illness for years, with positive thinking, sports, etc., and it still didn't work, showing it's not a simple head control problem. Make clear to yourself, your system learned independently of your conscious will. Now you're lovingly giving it a new direction. Guilt feelings or shame are counterproductive. Replace them with self-compassion. I'm making the best of a difficult situation, and I deserve no criticism but support. Confusing serenity with repression or giving up. Some fear that practicing serenity means ignoring or trivializing the illness. But that's not true. We fully acknowledge symptoms, but without dramatic evaluation. It's a sensitive difference. Repressing would mean acting as if you were healthy and exceeding your limits, often a past mistake. Resigning would mean pessimistically thinking it'll never get better. Functional indifference, however, acknowledges both current limits and possibility of improvement. You still care for your body, medications, rest, etc. Only emotionally you react differently. Experience shows exactly this non-fighting can open surprising doors. Many report that symptoms only slowly receded when they stopped fearing or hating them. Impatience and expectations. It's understandable to want to be healthy as quickly as possible, but too high expectations in short time can become a boomerang. Deconditioning is a process over weeks and months. Progress often comes in waves, sometimes noticeable, then apparent setbacks again. Don't get discouraged. The brain needs repetition. Often the environment notices small changes first, like you seem somewhat more relaxed in dealing with your energy, before you feel big breakthroughs yourself. Celebrate small improvements. They add up. And even if physical symptoms only slowly diminish, your suffering can already reduce significantly, simply because you become freer internally. That's already a huge success and paves the way for physical improvement. Relapses and crashes will never be completely absent. CFS runs unpredictably. When a relapse comes, see it as part of the learning process, not as failure. Every crash offers retrospective learning material. What triggered it? How did I deal with it? What can I do differently next time? Maybe it was also simply chance, infection, etc. Important, in bad phases, especially don't completely let the mental practice slide. You can even practice living through a crash equanimously, e.g., lying in bed consciously instead of panicking that everything is now ruined. This way, the setback becomes a training camp for your serenity muscles. And consider, often better times come after setbacks. That's the case in most recovery reports. Staying with it pays off. On the other hand, there are great opportunities in this approach. Regaining self-efficacy. Many CFS sufferers feel helplessly at the mercy. Through unlearning, you can become an active participant in your healing process. This self-efficacy alone often already enormously improves psychological condition. You no longer feel only like a patient, but as a learner, as someone who can shape something. That gives hope and meaning. Transferable life skills. The ability for serenity helps not only against symptoms, but generally in life. Stressful work situation, interpersonal conflict. With what you learn in dealing with CFS, you're better equipped to master other challenges with calm in the future. Many recovered people even report emerging stronger from the illness, more centered, mindful, wiser in dealing with themselves.
Synergies with other treatments. This approach excludes no other therapies. On the contrary, it can support them. Those who are treated medically or try certain diets/infusions, etc., will respond better when the nervous system is relaxed. Studies in psychoneuroimmunology suggest that placebo and nocebo effects massively depend on mental state. The safer and more confident you are, the more likely medical measures can work because the body doesn't work against them. Serenity is also a therapy amplifier. Participation in life. Finally, the biggest goal. Step by step being able to participate in normal life again. Maybe initially in small doses. Having coffee with friends again, briefly but present. Pursuing a hobby as far as possible. Every such successful participation is doubly positive. It nourishes the soul and proves to the body that activity doesn't have to mean catastrophe. A positive upward spiral opens up where only downward spirals used to be. Conclusion: looking forward with hope. In summary, the idea of understanding CFS as a conditioned immune reaction represents a paradigm shift, away from purely fighting an unknown defect toward unlearning a misdirected protective reflex. This unlearning requires patience, kindness toward oneself, and consistent practice of serenity. It's not an easy path, but a possible way out of powerlessness. We've seen that scientific findings from various areas support this approach. The brain can change, the immune system can be reprogrammed, and ancient wisdom teachings as well as modern therapies show the value of equanimity in the face of suffering. Completely unlearning CFS may sound ambitious, but even a weakening of automatic reactions can considerably improve quality of life. Every small victory, a day with somewhat more energy, one fear less, one activity more managed, is a step out of the cage. It's important that sufferers aren't left alone. Doctors and therapists should openly encourage and medically secure this approach. It needs a cooperation of conventional medicine and neuropsychological self-help. The journey may be long, but it's not hopeless. On the contrary, it's hopeful. Because what is learned can be unlearned at any age, even after long illness.
The nature of our brain is change. By gently giving your brain new experiences of safety, of everything is good, you don't have to fight, you promote the possibility that your body can gradually relax and heal too. In the end stands no lesser goal than this: regaining trust in your own body. Imagine you could one day say, "My body and we're a team again. We react appropriately to real demands, and we rest when necessary, but without false alarms." This goal is worth working toward. Every day offers new chances to break old patterns a little bit. In this sense, stay patient and confident. Your body is not a rigid, hostile object. It's capable of learning, just like you. Let's begin to show it a new way with Serenity.